Hi guys, in this video let us discuss something about the Vancouver scar scale and scar assessment. Now this is very important because it is frequently asked in exams, and also from practical point of view various scar assessment scales and the need of scar assessment is important. Let us see how it is important. So first of all, let us see why is there a need of scar assessment for any post-burns contracture. Firstly, it is important to prognosticate. By prognosticate, I mean when a patient first comes to us with, for example, a Vancouver scar scale of maybe 10 or 12, and he asks us what is going to be the outcome of the scar if we are going to give pressure garments, if we are going to start massage or laser or some other modalities. So generally it is seen that higher the scar or worse the scar score, the outcomes are going to be comparatively not so good. So that is how we can use the scar assessment to prognosticate. Secondly, it is used to assess the progress. So for example, right now we have a particular scar score and we have started the patient on pressure garments, and after 3 months of regular pressure garment use, we can show the patient that this was your scar score before we started this particular modality, before we started pressure garment, before we started laser, and after 3 months of dedicated usage, your scar score has improved significantly. Although there is a subjective criteria patient themselves can assess, but scar assessment score is one of the objective criterias by which we can document the progress of whatever modality we are using to manage the scar. Then thirdly, it is used to assess outcomes. By assess outcomes, I mean we have suppose intervened it pre-operatively, the score was so and so, post-operatively the score was so and so. So whether there is improvement, whether there is deterioration, that way we can assess our modality of choice or our treatment modality and assess whether it is beneficial or not beneficial. And finally, it is used to compare outcomes. Now we can use different modalities for a single type of a scar. So we can use, probably you can use only pressure, or you can use silicone sheets. So this is useful in research as well. Scar assessment can be used to objectively assess and compare outcomes of various modalities being used on a single scar. So that is why scar assessment is important and it shouldn't be neglected. We should give a scar score, we should assess the scar on a scar scale at every point of time. Coming to what are the modalities for scar assessment, Vancouver scar scale is the commonest scar scale which we use. We use it in clinical practice, we use it in exams. So that is one of the commonest scar scales. Apart from that, there are a variety of scar scales. Just to name a few, we have a Manchester scar score. Then there is the patient and observer scar assessment scales, which is called as POSAS, in which the patient is also involved in the assessment of the scar. And then we have our conventional VAS, the visual analog system, which is typically used for assessment of pain, but in a modified manner can also be used to assess various types of scars. Now let us move to the actual scar assessment using the Vancouver scar scale. So 4 parameters are typically used in this. The mnemonic which I tend to use is HPV, which H stands for hypertrophy, first P is for pigmentation, second P is for pliability, and V is for vascularity. So we want to assess these 4 parameters and give them markings and eventually come to our Vancouver scar scale score.